So when should we not restore the temples? If someone has an advanced Norwood scale and they have large areas of the scalp that are just uncovered, it's usually best to delay any type of temple work until we get better overall scalp coverage. And then later on, we can maybe come back and add in the temples. But having, again, strong temples and other, large areas of weakness on the scalp as far as hair density goes really doesn't lend well to a great aesthetic overall outcome. Another situation where you might consider avoiding any type of temple work is if someone has a limited donor supply. So most people have, let's say, about 6,000 to 8,000 grafts to give from the donor area over the course of usually several procedures. But if someone has a very thin donor area, or they've had prior surgery and they're down to maybe 3,000, 2,000, maybe 4,000 tops grafts to give, and you have these other sections that are very critical to cover, then usually you'll never really get to the temples, and people just need to accept that they'll have an improved overall state of their hair, but they won't have those really sharp and anteriorly projected temples, and that's still okay. Another situation where we might avoid doing temple work is if someone is chasing perfection or has unrealistic expectations. Really we try to avoid operating on patients like that completely, because they probably will never be happy. This is surgery, this is aesthetic surgery. No one starts off perfect and no one ends up perfect. You can always point fingers at things that are not perfect, and it's those imperfections that usually lead to a more natural type of result. So when I have patients who have very, very high demands where I don't feel that I can meet their goals, then it's better to just not operate, and that's okay.